Hello Ignasi, we are Marc Macià and Roger Camilla, and we are going to tell you and explain what is the lung cancer. The lung have too many purposes: to transfer oxygen into the blood when you breathe in, to expel carbon dioxide out of the blood when you breathe out. The lungs are made up of a series of sections called lobes. The left lung consists of 2 lobes. The right lung is larger and consists of 3 lobes.
Lung cancer is a disease characterized by uncontrolled cells growth in tissues of lung. If left untreated, this growth can spread beyond the lung in a process called metastasis into nerve tissue and eventually into other parts of body. Most cancers that start in lung, known as primary lung cancers, are carcinomas that derive from epithelial cells.
Types of lung cancer. Cancer that begins in the lungs is called primary lung cancer. Cancer that begins in another part of the body and spreads to the lungs is known as secondary lung cancer. This topic is about primary lung cancer. There are too many types of primary lung cancer. They are classified by the type of cells in which the cancer starts. They are non-small cell lung cancer, called squamous cell carcinoma, adenocarcinoma, and large cell carcinoma. And the other type is small cell lung cancer. Non-small cell lung cancer. Non-small cell lung cancer is the most common type of lung cancer, accounting for around 88% of all cases. Small cell lung cancer. Small cell lung cancer accounts for around 12% of all cases. Small cell lung cancer is more aggressive than non-small cell lung cancer, and it usually spreads faster. How common is lung cancer? Lung cancer is the second most common cancer after breast cancer in England and Wales. An estimated 40,800 new cases are diagnosed every year. Lung cancer mainly affects older people. It is rare in people under 14 years old, but the rate of lung cancer rises sharply with age. Lung cancer is most commonly diagnosed in people who are 70.
Smoking, particularly of cigarettes, is by far the main contributor to lung cancer. Cigarette smoke contains over 16 known carcinogens, like radioisotopes, nitrosamine, and benzopyrene. Additionally, nicotine appears to depress the immune response to malignant growth in exposed tissue. In the developed world, 90% of lung cancer deaths in men during the year 2000. Smoking accounts for 18 and 19% of lung cancer cases.
Another contributor to lung cancer is the outdoor air pollution, that has a small effect on increasing the risk of lung cancer. Fine particulates PM2.5 and sulfate aerosols, which may be released in traffic exhaust fumes, are associated with slightly increased risk. The nitrogen dioxide increased the risk of lung cancer by 14%. Outdoor air pollution is estimated to account for 1 to 2% of lung cancers.
Some people have a genetic predisposition to lung cancer. In relatives of people with lung cancer, the risk is increased 2.5 times. This may be due to genetic polymorphisms.
Passive smoking is another cause. The inhalation of smoke from another smoking is a cause of lung cancer in non-smokers. Symptoms and signs that may suggest lung cancer include respiratory symptoms, coughing, hematosis, coughing up blood, wheezing or dyspnea. Systematic symptoms, weight loss, fever, clubbing of the fingernails or fatigue. Symptom due to local compress, chest pain, bone pain, superior vena cava obstruction, dyspepsia, and difficulty swallowing.